Awareness Month, an estimated 100 million Americans suffer from chronic pain. It's affecting our sleep and causing discomfort, but there is hope. Here to show us breakthrough techniques to manage chronic pain is Dr. Natalie Strand. Good morning to you, doctor.
Good morning. Thank you so much for having me.
Our pleasure. As I just mentioned, 100 million people live with pain. Does that number blow you away?
It is an epidemic, yes. It's almost 1 in 3 Americans at this point, and it is a huge problem.
Now let's talk about some examples of chronic pain conditions. What kind of conditions do you see in your office?
All kinds of conditions, certainly osteoarthritis, fibromyalgia, sciatica, painful diabetic neuropathy. These are all examples of chronic pain, and chronic pain being defined as pain that has been lasted 3 months or longer.
And so 100 million people have this condition. What are we supposed to do about this? How do we get relief?
It is a huge problem, and it's a difficult to treat problem, to be honest. We really need to tailor treatments to each individual patient. It's often a combination of therapies, so certainly medications are appropriate sometimes, interventions are appropriate sometimes, lifestyle modifications are almost always appropriate. We all need good sleep, good nutrition, good exercise, and in addition we need new technologies, so non-opiate technologies like the Quell device that utilize our body's own system to actually turn down the pain signals and offer pain relief.
And how does that work?
Well, it's a wearable device. The technology is a wearable intensive nerve stimulation, and it's worn on the calf. It stimulates a sensory nerve that then signals to the brain to release your own opioids and turn down the pain sensation in your body.
And is this something that we can get over the counter? Do we have to go to the doctor? Do we have to be diagnosed? How do we get our hands on it?
Well, yes to all of those questions. So it is available without a prescription. quellrelief.com is the website to learn more or purchase a unit. I also encourage everybody to work with your doctor. Go to a chronic pain management specialist so you can get a tailored plan. Quell can work with medications or without medications, so it's important to have that discussion with your physician.
Now, for people who take medications and prescription drugs, do many of them tend to get stuck on those drugs? It's something that they have to use for the rest of their lives?
Well, it's certainly possible, and depending on the kind of medication that you're using, it's a bigger problem with opioids than it is, say, with other pain medications that aren't as addictive or that you don't develop a tolerance to. But certainly, if the reason you're having pain isn't something that's going to heal or get fixed with a surgery and you're going to have the pain for the next 5 to 10 years, I really encourage patients to try to use non-opiate therapies. You know, use dietary modifications if you can. Use physical therapy or exercise if you can. So it's important to use medications when you have to, but if you can reduce your dosage or reduce the time that you're on the medications, I think that's really popular with a lot of patients and with physicians alike.
Yeah. Does physical therapy help with a lot of patients?
It absolutely does. And you know, certainly exercise helps a lot. So a lot of patients think if you're having pain, you can't be active. And while you might have to change the style, you might not be able to go for a 10-mile run, for example, but mild to moderate activity, often things in a pool or gentle motion, anything that lubricates the joints is especially going to be helpful with things like arthritis.
Well, doctor, some great information for us. Thank you.
Oh, my absolute pleasure. Thank you.
To learn more about this breakthrough in managing chronic pain, just visit the website right there on your screen.